السلام عليكم. نبدأ سليمان.
Doctor, we can start.
So good morning. Thank you all for attending the Dermatology Department Grand Round. It is my pleasure to introduce Dr. Sulaiman Al-Faraj, who is a Senior Registrar at the Department of Dermatology. He will be talking about SARS-CoV-19 from a dermatology perspective. Dr. Sulaiman, the mic is yours.
Thank you, Dr. Sheikha. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. On behalf of Department of Dermatology and Dermatological Surgery, I welcome you all in this grand round of Prince Sultan Military Medical City. My name is Dr. Sulaiman Al-Faraj. I'm a Senior Registrar of Dermatology. And with me, Moderator Dr. Sheikha Al-Aujan. She's a consultant dermatologist. And today we'll speak about SARS-CoV-2 or COVID-19 from a dermatology perspective. So SARS-CoV-2, or as we all know, COVID-19, was first reported in China in late 2019. It affected more than 100 million worldwide and more than 220 plus countries reporting confirmed cases up to date. And with that, the mortality rate is estimated to be around 2%, and various cutaneous manifestations were reported since the pandemic started. And current state in Saudi Arabia of the pandemic, the total confirmed cases is around 370,000 cases, with total death is around 6,514 deaths. And total recoveries is around 370,000 recoveries. Distributing these numbers in the region of Saudi Arabia, we see that Riyadh comes in first with almost 65,000 confirmed cases. Jeddah comes in second with 35,000 cases. Mecca al-Mukarrama in third with 35,000 cases. Al-Madinah al-Munawwara in fourth with 22,000 cases. And Dammam with 20,000 cases. So when we looked into the literature, we found more than thousands of reported articles published in the literature since the pandemic started about COVID-19 in dermatology. And with that, we wanted to know what are the cutaneous manifestations that those patients who are confirmed to have COVID-19 infection presented with. And so the first and the most common one is the maculopapular rash. This is estimated in multiple articles to be around 40% of all the cutaneous manifestations that were presented with patients with COVID-19. This is an eruption usually present over the trunk, and as you can see from the right picture, the classic blanchable erythema that can come with the maculopapular rash. This is also another patient who are published in the literature having or showing the maculopapular rash over the trunk. Another very common presentation with COVID-19 is the pernio-like eruption or the COVID toes. This eruption in specific comes usually with young adult healthy patients. Those patients are having mild case or mild disease of COVID-19. It usually present over the toes and affect mostly the distal part rather than the proximal part, with the classic non-blanchable erythema as you can see from the picture here. Another reported presentation of COVID-19 is urticarial eruption. Although this is a non-specific presentation that can come with many other viral infections, it was also reported here with COVID-19. This patient showing the urticarial eruption over the chest, as well as it can present over the extremities, as it was reported here with this picture, showing the urticarial eruption over the lateral thighs. And this is another form of urticaria. It's called physical urticaria or dermatographism. This is an urticarial eruption that presents after you literally can write on the patient. And it shows here on the patient back that the author wrote COVID and the urticarial eruption presented. Vesicular eruption or varicella-like eruption was also mentioned in the literature. And this is a very interesting presentation because earlier in the pandemic, a lot of patients who presented to the ER with this vesicular eruption were initially diagnosed with varicella and they started on antiviral medication. And when the varicella serology came, those patients showing IgM negative, however, the IgG positive, indicating that those patients were having a past infection of varicella rather than an active one. And later on, the other symptoms of COVID-19 presented, such as fever, cough, shortness of breath, and even abdominal pain. And with the serology positive for COVID-19, those patients were diagnosed with COVID-19 infection. So vesicular eruption in particular can present or can precede the other classic symptoms of COVID-19. This is also another reported patient showing the vesicular eruption over the right thigh. And petechial eruption is one of the other skin manifestation or the cutaneous manifestation of COVID-19. It can present over the trunk as well as in the extremities and even the palms as sores with its classic non-blanchable erythema. And retiform purpura or livedo reticularis was also one of the cutaneous manifestations that were mentioned in the literature. And this is very interesting because in the literature, most of the patients who presented with retiform purpura or livedo reticularis were those patients who were having severe acute infection, those patients requiring hospital admission and even ICU admission. This is probably due to the abnormal coagulopathy status that the patient with COVID-19 can present with that was discussed earlier in the disease. And this retiform purpura or livedo reticularis can present over the extremities, the trunk, and even in the buttock, as you can see here from the pictures. Erythema multiforme is well known to be caused by a viral infection and was also mentioned here with COVID-19 infection. You can see from the left side picture the classic target lesion of the erythema multiforme showing the 3 discrete zones over the patient dorsum of hands. Another disease that is well known to be caused by a viral infection is pityriasis rosea and also reported with COVID-19. You can see from the right-sided picture the classic herald patch with the Christmas tree distribution of the other lesion over the patient trunk. And lastly, pruritus. Although this is a non-specific presentation that can come with many other infection or even other dermatological diseases, it was mentioned here in multiple reports with COVID-19. And you can see the excoriation mark over the patient back over, from the right-sided picture. And this is a nice algorithm showing the severity of COVID-19 with its associated cutaneous manifestation. On the left side or the left end of the spectrum, those patients who are young, healthy adult, those patients who are having mild disease, Bernio-like eruption or COVID toes were the predominant feature in those patients. However, in the moderate severity of the infection, maculopapular rash or morbilliform rash, urticarial eruption, and even vesicular eruption were the predominant feature. And at the other end of the spectrum, those patients having acute severe infection requiring ICU admission, petechial and retiform purpura, secondary to the abnormal coagulopathy, were the predominant features in those patients. And how about SARS-CoV-2 or COVID-19 in pediatrics? Are those populations at any higher risk? Well, in the literature, there were multiple reports in JAMA and even Lancet about the pediatric inflammatory multisystem syndrome or Kawasaki-like disease. Those patients usually present with fever, myocarditis, peripheral edema, nausea, vomiting, abdominal pain, and even lymphadenopathy, with elevated ESR, CRP, and ferritin level. Those patients also can present with conjunctivitis and cutaneous whites. Those patients were having non-specific rash, most likely maculopapular rash in 55% of those patients, and oral or mucocutaneous lesion in 35% of those patients. Now let's stop and see the other way around and see how did the pandemic affected our common dermatological dermatosis that we see in our daily practice. And the first one we'll talk about is psoriasis. Psoriasis is very common and it is estimated to affect 2% of the worldwide population. And in the literature, there were multiple reports about exacerbation of patients who are having chronic plaque psoriasis with COVID-19 infection. Hydroxychloroquine is well known to exacerbate psoriasis as it has been used a lot earlier in the pandemic. And there were also few reports of a new onset of pustular and guttate psoriasis. Many patients of psoriasis nowadays are on immunosuppressive or even biological treatment. So the recommended guidelines for those patients in the time of pandemics is to continue on biologic or even immunosuppressive treatment and only withheld during active infection. Atopic dermatitis is also very common in our practice, and in the literature, there were no reports of any new onset atopic dermatitis. However, if the patient is already diagnosed with atopic dermatitis or having chronic atopic dermatitis, there were reports of exacerbation of his disease or her disease with COVID-19 infection. And again, if the patient is on immunosuppressive, the recommended guidelines to continue on the immunosuppressive treatment and only withheld during active infection. And specifically with atopic dermatitis, dupilumab is a new FDA biological treatment that's for atopic dermatitis that targets interleukin 4 and 13. And it showed in the literature a safety profile during active infection. So you might proceed those patients with this medication with cautions, of course. Autoimmune bullous dermatosis, in the literature, there were no reports of any new onset pemphigus vulgaris or even bullous pemphigoid. And if the patient is any immunosuppressive or biological treatment, again, as in psoriasis and atopic dermatitis, to continue on the treatment and only withheld during active infection. And lastly, lichen planus. Lichen planus is a very common in our practice. And in the literature, there were no reports of new or any exacerbation of lichen planus. And only we found one report of a new onset of annular lichen planus over the legs, as you can see here from the picture, and the recommended guidelines that the patient can continue on the immunosuppressive treatment and again only withheld during active infection. And this is a nice table I found about the drug safety recommendation in the context of coronavirus disease or COVID-19. And they categorized medication based on the risk of harm to the patient. So the first group that the evidence suggests harm is systemic steroid. This is possibly due to the strong dose dependent and the immune suppression effect and the risk of infection in general with systemic steroid. The second group showing mixed data and only proceed with caution, and this group include rituximab, cyclosporin, azathioprine, and mycophenolate mofetil, JAK inhibitors, and TNF-alpha inhibitors. Rituximab because of the prolonged B cell depletion and the risk of not developing antibody if the patient got infected with COVID-19, the risk of not developing antibodies against the virus. Cyclosporin because it has multiple drug and drug interaction and the frequent lab monitoring needed and the frequent also hospital visits. Azathioprine and mycophenolate mofetil because it will not be associated with viral infection such as herpes zoster and CMV. JAK inhibitor because it also has a risk of viral infection and also the risk of DVT and pulmonary embolism. TNF-alpha inhibitor because of the severe immune suppression that those medication can cause. And among the TNF-alpha inhibitors, infliximab showing the highest risk, especially with doses higher than 10 milligram per kg per dosing. The third group showing low risk to the patient or low risk of harm. And this group include interleukin 17, such as secukinumab, and methotrexate, interleukin 12 and 23, such as ustekinumab or Stelara, and the new biologics that were introduced recently, the interleukin 23 inhibitors, such as guselkumab and risankizumab. And the last group they are not immunosuppressive, however, more of immunomodulatory, and they have showed a safety profile during active infection or during pandemics or this pandemic in general. And this group include apremilast, dupilumab, as we discussed before with atopic dermatitis, hydroxychloroquine, although to date no evidence for benefit in treatment of COVID-19. Hydroxychloroquine was used a lot earlier in the pandemic, and the evidence suggests no benefit in the treatment of COVID-19. Other agents such as retinoid, dapsone, and colchicine also safe during infection. And with the rise of the pandemic and the great emphasis on the personal protective equipment, we saw a huge number of patients who presented to our clinic with contact dermatitis or hand contact dermatitis. This is secondary to the vigorous use of soap and hand sanitizer, as well as a new entity that was named face mask acne. This is an acne eruption over the cheeks bilaterally, secondary to the prolonged use of the surgical face mask and even N95 mask. And I want to speak briefly about the telemedicine in the era of COVID-19 and specifically teledermatology. Since the pandemic started, or since the first confirmed case of COVID-19 in Saudi Arabia back in March 2020, Prince Sultan Military Medical City and most of the other hospitals in the Kingdom of Saudi Arabia have shifted to the virtual clinic in the outpatient department, and dermatology clinic is no exception. We immediately shifted to the virtual clinic, conducting phone calls, triaging patient to continue provide healthcare needed to our patient. And I found this a nice article in the Journal of American Academy of Dermatology that was published back in July 2020 about the teledermatology in the wake of COVID-19, the advantages and the challenges that comes with that. And they summarized the article and they said teledermatology aided in triaging, diagnosing, and managing many dermatological conditions. Dermatologists can use teledermatology for routine follow-up and triaging of any urgent concern to be seen in person in clinic. Teledermatology presents an opportunity for greater access to care, even in the future. And it facilitates academic activities for the residents and the fellows, as well as the medical conferences. And we saw that last year with the huge number of attending virtual conferences in comparison to the physical ones that were held before. However, teledermatology or technology can fail. Internet outages, overload servers, and incompatible client hardware can be an issue. Not all illnesses, as we all know, can be diagnosed remotely, so this patient might need to be seen in person or in the clinic. It requires, as we all know, additional training, and protection of medical data of the patient, especially with external servers, can be an issue. And lastly, it may be harder to create a personal connection between the doctor and the patient, which is very important. And at the end, I just want to speak briefly about the current situation, or where are we now here in Saudi Arabia with the pandemic. So, alhamdulillah, Saudi Arabia is one of the first countries to provide the vaccine or COVID-19 vaccine to its population, free of charge with easy access to book your appointment through phone application. And here in the medical city, we have our own vaccine center that is held behind building this 37, free of charge and easy access to all the healthcare worker to get the vaccine. So I encourage all of you to get vaccinated to help, inshallah, in the pandemic as soon as possible. So at the end, take-home message, various cutaneous manifestations are associated with SARS-CoV-2 infection. Acquaintance of different dermatological manifestation of SARS-CoV-2 infection may help in the diagnosis. The effect of the personal protective equipment on our skin. Teledermatology can be a useful tool in managing patient and continuous medical education during pandemics. And with that, I end my presentation. My name is Dr. Sulaiman Al-Faraj. I'm a Senior Registrar of Dermatology. With me, moderator Dr. Sheikh Al-Ojan, a consultant dermatologist. Thank you so much for your time and listening. Thank you.
Thank you, Dr. Sulaiman, for this informative and up-to-date lecture. If any of the audience have any questions, please type them in the Q&A box or raise your hand, please, to be unmuted. So there are no questions yet, Dr. Sulaiman. I would like to kindly ask you about the correlation between the cutaneous manifestations of COVID-19 and the severity of disease. Is there any relation between them?
Well, in the literature, when we looked into the literature, there were multiple reports about the, as you said, the severity and the correlation of the cutaneous manifestation. And they mentioned that if the patient is young, healthy, and having a mild disease or COVID-19, pernio-like eruption or COVID toes were the predominant feature in those patients. However, if the patient is having moderate severity of COVID-19, maculopapular rash, which is also the most common presented feature in all of the cutaneous manifestation of COVID-19, with urticaria and vesicular eruption were the predominant feature. However, if the patient is ill, having severe infection requiring hospital or even ICU admission, petechial eruption and retiform purpura or livido reticularis were predominant feature, especially with the abnormal coagulopathy that those patients with severe COVID-19 infection can present with.
Okay, perfect. So I think there are no further questions. Thank you, Dr. Sulaiman, and thank you all for attending, and have a nice day ahead.
Thank you so much, Dr. Thank you for the audience as well.